Warning an at-risk population without stigmatizing that very same population, that is the challenge with the 2022 monkeypox outbreak.
So the LGBTQ plus community historically has had a problematic relationship with the medical and mental health field.
Stephen Hayden is the founder of Envision U, a Denver-based nonprofit focused on the mental health and well-being of Colorado's LGBTQ plus community. Monkeypox is spread through close or intimate contact. The majority of cases today are among men who have sex with men, but public health officials stress this can and has spread beyond one population.
When you closely associate a public health concern like this with a certain population, it does prevent folks who are not part of that population from seeking care.
Headlines matter.
The problem with that headline, again, is it's suggesting that this is a disease or a concern that should only impact gay men, and in fact, that's not true.
And history matters, says Hayden, from the HIV/AIDS epidemic of the 80s and 90s to the modern-day political battles over LGBTQ rights.
The community is already experiencing some profound mental health challenges through stigma, discrimination, and targeted harassment. And so as you think about how do we target messages, especially around public health emergencies like the monkeypox, we need to be very thoughtful about how do we craft and target certain populations with messaging, how do we engage folks in a way that they feel safe and understood, and using culturally relevant and affirming language is essential.
Hayden said we have another recent example and a warning about the risks of targeting a certain population. For example, during COVID, he said we saw a lot of anti-Asian discrimination, even violence. Something to be mindful of as we move forward covering monkeypox.
Absolutely.